Greetings. Thank you to my colleagues and to the ASGE for giving me this opportunity. And thank you all for being here. And you may be wondering why I have selected this picture and this book. I want to frame this question: how good is your endoscopy crew? If you think you need help to build a better crew, we have some good news. Surgical techs go through a formal training before they can enter the surgical operating room. But in our case, we try to train them on the job, and it's not the best option. To fix this problem, we wanted to develop a dedicated endoscopy tech training course, and it is a long journey. I want to share with you what we have done. We started in 2015 with a pitch to the chancellor of the community college, and that led to inviting 10 endoscopy technicians from Texas Medical Center, and with the help of the dean for curriculum development from the Houston Community College, worked with them for 2 days to figure out what do they do from the time they clock in till they clock out. And with the help of an advisory board of endoscopists, Kyle Patel and others, industry partners like Tom Slocum and others, and endoscopy technicians like Laura, who's here, and others, worked together with the community college for almost 2 years to finalize the curriculum that was approved by the Southern Association of Colleges and Schools. And finally, we launched the course in 2021. Unfortunately, the community college don't have any experience in endoscopy, so we took it upon ourselves to create the course material, 19 credit hours of course material, with the help of a fantastic educator, Ms. Sanji Suresh, a graduate of WashU, who taught science for high school kids as part of the Teach for America program, and also obtained Masters in Education with that background, and Ms. Angela Deal, a former faculty member at UT Southwestern Medical Illustration School. We three of us worked together with support, a huge support from my institution, funding support, created a richly illustrated educational material that is good for high school graduate students. We also took one more step, and every lesson was converted into an audio recorded video so that the students can use the video for a flipped classroom type of learning. So review the video before they go to the class, and then use that as an opportunity to enhance their learning. To give you a sample of how each lesson was created, special thanks to Sanjay, who has done a lot of this work with the help of Angela. So let me take you through the entire lesson plan on band ligation. So because the students don't have a clue about band ligation, we want to introduce where it is used, in this case for varicose band ligation and band ligation of Barrett's esophagus, as you can see with images, a little bit about the anatomy of portal venous system in health and in disease, and how portal hypertension leads to varices, and how these varices grow, develop signs of impending rupture, and then what can we do to manage these varices with the help of band ligation. So we want to give as much illustrated type of education to the students as possible, with focus on some details that we wanted them to learn about the density of the perforator veins, because this is important regarding where we should place our bands. Coming to the technical part, we didn't want to throw in a bunch of photographs. We took pains to illustrate every single step. In this case, you will see the band ligator introduced step by step, different parts, and then the differences between how to manage the control handle, firing versus two-way position, and then going step by step how to assemble the band ligator to the point of giving the device loaded so that the view is good, and also taking precautions to keep it in the two-way mode so that accidental firing of bands would be avoided. And then we talk about what an endoscopist does when he goes into the esophagus and where does he put the bands in the distal 5 centimeters. You can see as you're going through this, everything is illustrated for a high school student to learn. And then we went one step further to teach about contraindications, especially latex allergy with certain bands, complications, and finally ended up with an opportunity for them to review and learn using cases as well. And finally included some reference material. So we took a lot of pains to make it easy for somebody brand new to band ligation to learn and get the concept. So we deployed this to I'm really delighted that my institution, my president, Dr. Pistos, was kind enough to allow me to donate this entire material to the Houston Community College. The first batch started in 2021, and so far 3 batches graduated, including the last one a few weeks back. All of them took the ASGE certification, ASGE assessment exam, and they've done well. When we compared their output to experienced technicians from MD Anderson Cancer Center, they've done very well. So far I've talked about how a student who joins the community college goes to the program for 1 year and gets out with level 2 certification and 35 credit hours. How about somebody who's already working in your endoscopy lab? How do you help them? Just last week, the dean of the Houston Community College shared with me that any technician in your lab with 4 years of experience that you say that is good enough to support EGD colon enteroscopy can take the ASGE test that everybody else has taken, and then PLA out, that means prior learning assessment out, and get 75% of the course material done for just a few $100s. This, and they can take some more learning courses online and get level 2 certificate. And if they add 35 credit hours more, they can get an associate degree with specialization in endoscopy technology. You know what's an associate degree mean? It's the pathway for BSN. So you can see how this whole program can help our endoscopy technicians and also help us do better by having the best crew. I want to take what our college, that is the American Society for GI Endoscopy, is doing. I want to thank the leadership the governing board and the presidents in the last few years who have signed off to create the associate membership for endoscopy technicians. All my technicians joined as associate members from MD Anderson, and I hope you encourage your technicians to join for a very nominal fee. They will have access to this entire learning material. Again, thanks to my president of MD Anderson, who allowed me to donate it free of cost to the society. And they can also take the certification. So far, all the graduates of the community college, my own crew from MD Anderson, as well as some from Mayo already took the certification. They achieved more than 75% correct responses in the 200 question test. And I would like to request Laura in the question and answer session to share her experience. Laura is our chief technician and has been with me on this journey for the last 10 years. To conclude, we have a fantastic opportunity, what the society has done, what the community college has done, to create a comprehensive training program, offers an opportunity to orient new technicians, new nurses, because most places don't have these opportunities. And they can also get certified. They get certification of completion, which the HR is likely to recognize and pay them without you trying to go and bang their doors asking them, can you do me this favor? And finally, there is a pathway for advancement of any technician joining your system. They can get educated on during their work, get level 2 certificate, go up to associate degree, and maybe bachelor's in nursing with specialization in endoscopy. We don't have them. I hope you all join as crew and row with me so that we can all provide better service to our patients. Thank you.